wise person say that with your filler, think of it like you're dating it at first, you're not marrying it. It takes about 3 to 4 weeks till you've really married it. She's started to get just a little bit of flattening in the cheek area and just a little bit of prominence of the lines in these areas here. So she doesn't need much, she just needs a little bit, but she's really at the perfect age where we can use a little bit of filler and it's really gonna refresh things. By lifting the cheek up, you're actually gonna soften the lines there too. So you want to kind of restore the normal curvature to the cheek. That's going to give us some lifting of those areas, and then we can just use a little bit of filler to soften the rest. Typically a filler will feel a little bit firm. Sometimes it can feel a little bit lumpy at first, and then usually it smooths and blends. Different fillers are made up of different thicknesses and consistencies, and so it depends on what the product is and where we place it as to how long you're going to expect that things will feel a little bit different. I usually tell people that the way it looks when you leave is still not how it's going to look. Depending on what areas we've worked on, in general, I would say it's probably about 3 weeks to get to your final look. I heard a wise person say that with your filler, think of it like you're dating it at first, you're not marrying it. It takes about 3 to 4 weeks till you've really married it. We're actually putting a product in there, and you're always gonna have on the inside a little bit of bruising and swelling. So even if it's not visible, on the inside you're always gonna have at least some. I've chosen a filler that's specifically suited to give her some lift in the cheek area. She's had it before, so she does kind of know what to expect with things. I like this one. Okay, so that's done exactly what we want. It's just giving her just a little bit more fullness in that area there. So she just has just that little bit of a crease in here, and we're just gonna soften it ever so slightly. The nice thing about many of the fillers we have today is they're just really soft and moldable, and you can see how that's making that go right away. Okay, and that's really all she needs.